everyone, welcome to Nursing Studio. Today's paper is 2020 Child Health Nursing. Question number 1, define growth and development. Growth and development को differently define करना है. Growth refers to increase in physical size such as height, weight, head circumference and body organs due to multiplication of cells. Quantitative process and measurable. Development is a progressive increase in skills and functions such as motor, cognitive, emotional, and social abilities. Qualitative process, not directly measurable. Next, principles of growth and development. Easy to learn mnemonic is order grows. Growth parameters of infancy. You can use mnemonic WHHCDC. Weight, height, head circumference, chest circumference, fontanelles, and here is quick revision of growth parameters: weight, length, head circumference, chest circumference, teeth. और ये शॉर्ट चार्ट है, सिंपल एंड शॉर्ट ब्रीफ में आप देख सकते हैं. Here is question 2, in which situation is giving intestinal obstruction. You can learn the definition of intestinal obstruction by the word block. Blockage, lumen of intestine, obstructs food and fluid, complete, partial, kills normal movements. B is causes and pathophysiology of intestinal obstruction. Causes आप निमोनिक से देख सकते हैं, कुछ एक्स्ट्रा में नीचे दिए गए हुए हैं. नाउ पैथोफिजियोलॉजी इज डिस्टेंट से आप याद कर सकते हो. And you can see from the flow chart given below: obstruction, bowel distension, pressure on blood vessel, decreased blood supply, necrosis, perforation, and last peritonitis and shock. Next is management of intestinal obstruction. Mnemonic is relief, resuscitation, empty stomach, lost replacement or can say fluid replacement therapy, investigations, eliminate cause, vital sign monitoring, emotional support and education, and other extra point if you want to learn, then here is care baby. Next question is neonatal resuscitation. You can learn by the mnemonic new life. It is for newborn, emergency care, weak and absent breathing, lung inflation, improve oxygenation, facilitate circulation, establish normal respiration. Indications of neonatal resuscitation: use mnemonic blue baby. Preparation for neonatal resuscitation: mnemonic warm baby, warm environment, airway equipment ready, resuscitation bag and mask, monitor, bulb syringe, appropriate size mask, baby towel, oxygenation sources. Steps used in neonatal resuscitation you can learn by A, B, C, D, E. A, airway. B, breathing. C, circulation. D, drugs. E, evaluation. And after resuscitation, need to assess Apgar score. Apgar score stands for A, appearance, P, pulse, G, grimace, A, activity, R, respiration. It is done within 1 minute and next 5 minutes. Nursing responsibilities: care new. Complications: hypoxic brain injury, seizures, respiratory failure, death. आप शॉर्ट एंड सिंपल वे में एक फ्लो चार्ट देख सकते हैं न्यूनेटल रिससिटेशन का. नेक्स्ट इज चाइल्ड गाइडेंस क्लिनिक. What is Child Guidance Clinic? Child Guidance Clinic is a specialized multidisciplinary clinic that provides preventive, diagnostic, therapeutic and rehabilitative services for children with emotional, behavioral, developmental and psychological problems along with guidance to parents and teachers. आप इसको सिंपल निमोनिक के यूज़ करके भी लर्न कर सकते हैं. गाइड चाइल्ड. Objectives of Child Guidance Clinic: early detection, promote mental health of children, guide parents, help teachers to manage children problems, prevent future psychiatric disorders. Types of children seen in child guidance clinic with different behavioral disorders are behavioral problems, emotional disorders, learning disabilities, speech and language problems, enuresis, encopresis, autism, etc. अभी जो चाइल्ड गाइडेंस क्लिनिक में टीम मेंबर्स होते हैं वो सबकी तरह कॉमन ही है. साइकेट्रिस्ट, साइकोलॉजिस्ट, psychiatric nurse, speech therapist, special educator, social worker. Functions of child guidance clinic is psychological assessment, individual and family counseling, behavior therapy and play therapy, school guidance services, slow follow up and rehabilitation. Nurses role असिस्ट करना है, प्रोवाइड करनी है हेल्थ एजुकेशन, पार्टिसिपेट करना है काउंसलिंग सेशंस में, रिकॉर्ड्स मेंटेन करने हैं और कोऑर्डिनेट करना है स्कूल एंड कम्युनिटी के साथ. This is a short and simple overview of child guidance clinic. Hypospadiasis. It is congenital anomaly in male urethral in which the urethral opening is present on the ventral of the penis instead of at the tip of the glans. You can learn by a word hypopad. Causes. Risk factors of hypospadiasis is genetic factor, maternal hormonal imbalance, exposure to hormone drugs during pregnancy, prematurity, family history. Types of hypospadiasis: GP, glandular and penile. Clinical manifestations: urethral opening on underside, downward curvature, abnormal urinary stream, hooded foreskin, difficulty in standing urination. Diagnostic evaluations are physical examination at birth, assessment for associated anomalies, karyotyping. Management, you can learn by a word: care, corrective surgery, avoid circumcision, reconstruct urethra, ensure normal function and appearances. Nursing management, you can add preoperative preparation, postoperative wound and catheter care, pain management, monitor urine output, parent counseling and reassurance. Complications: urinary difficulty, sexual dysfunctioning later, psychological stress, infertility issues. Preventions and health educations: proper antenatal care, avoid harmful drugs in pregnancy, genetic counseling if family history present, early detection and referral. Next is behavioral disorder in children. Behavioral disorders are conditions in which a child shows persistent abnormal patterns of behaviors that interferes with social, emotional, educational or developmental functioning. You can learn definition of behavioral disorder by a word: behave. Common behavioral disorders which are seen in children: use mnemonic, nail bend. Causes of behavioral disorder: family, faulty parenting, anxiety and stress, malnutrition, illness, lack of love and attention, young age immaturity. Classification of behavioral disorder: there are various types of classification given. Some are habit disorders, elimination disorders, conduct disorders, emotional disorders. Management of behavioral disorders: you can use a golden mnemonic, that is guide child. Guidance to parents: understanding child needs, individual counseling, discipline, environment modification, correct nutrition, habit reversal therapy, involve school teachers, love and reassurance, drug therapy. Again, nurse's role: you can use the word nurse care. Preventions: happy, healthy family environment, adequate nutrition, positive parenting, play and recreation, yes to love and security. Short note on marasmus: you can learn marasmus definition by word marasmus. Marked wasting, age infant and young children, reduced fat and muscle mass, appetite usually present, sunken eyes, malnutrition, underweight for age, skin dry and loose. Now, marasmus is a severe form of protein energy malnutrition caused by prolonged deficiency of calorie and proteins, commonly seen in infants and young children. It is characterized by severe wasting of muscle and loss of subcutaneous fat given the children and old man appearance. Causes: you can learn by using mnemonic: poor diet. Clinical features: word wasted. The diagnosis: Diagnoses are weight for age, clinical examination, history of poor dietary intake, anthropometric measurements. Management is feed care. Frequent small feeds, energy dense diet, exclusive breastfeeding, pruning, treat infections, correct dehydrations and electrolytes, adequate warmth, rehabilitation, nutrition, educate mother. Nursing management is monitor weight regularly, maintain body temperature, prevent infections, provide emotional support, teach low cost nutritious diet. Prevention आप कर सकते हैं EVF के through till 6 months, time and adequate complementary feeding, improve hygiene and sanitation, nutrition education to parents, early identification and treatment. अभी आपको अगर मरासमस एंड क्वाशियर के करके बीच में डिफरेंस पूछा जाए तो आप ये सिंपली शॉर्ट फॉर्म में याद कर सकते हैं. मरासमस एंड क्वाशियरकर, मरासमस सीवियर वेस्टिंग, नो एडिमा, एपेटाइट प्रेजेंट, कैलोरी डिफिशियंसी, एंड क्वाशियरकर इज एडिमा प्रेजेंट, puffy face, appetite poor and protein deficiency. Next, it's pediatric nursing. Pediatric nursing is a specialized branch of nursing concerned with the care of infant children and adolescents, focusing on promotion of health, prevention of illness, treatment, and rehabilitation in a family-centered approach. Objectives of pediatric nursing is promote normal growth and development, prevent childhood diseases, provide holistic care, reduce child mortality and morbidity, educate parents and caregivers. Mnemonic you can use child care. Role of pediatric nurses: monitor growth and development, administer medication safely, assist in procedures, maintain safe and child friendly environment, provide health educations, family centered care. Parents are partners in care, respect family beliefs and cultures, encourage parental environments. Classification of low birth weight babies. Low birth weight babies in a newborn whose birth weight is less than 2500 grams respectively, irrespective of gestational age. अभी ये हमारा है क्लासीफाई किया गया है अकॉर्डिंग टू बर्थ वेट. बर्थ वेट इज़ लो बर्थ वेट, वेरी लो बर्थ वेट एंड एक्सट्रीमली लो बर्थ वेट. अकॉर्डिंग टू gestational age: small for gestational age, appropriate for gestational age, and large for gestational age. According to term, it is preterm, term, and postterm. Now, risk based on classification, if we talk about hypothermia, hypoglycemia, infections, and respiratory distress. Essential nursing care, if we talk about, that is kangaroo mother care, maintain warmth, exclusive breastfeeding, infection prevention, regular weight monitoring. Here is short and simple overview of classification of low birth weight babies. Tracheoesophageal fistula. Definition: tracheoesophageal fistula is a congenital anomaly in which there is abnormal connection between the trachea and the esophagus, resulting in difficulty in feeding and breathing in newborns. You can learn tracheoesophageal fistula by a mnemonic TOF care. This is short and simple brief explanation of tracheoesophageal fistula. Nephrotic syndrome. Nephrotic syndrome is a clinical condition in which children characterized by massive proteinuria, hypoalbuminemia, edema, and hyperlipidemia due to increased permeability of glandular membrane of the kidney. You can learn definition of nephrotic syndrome by a mnemonic nephro care.